Welcome to Follow the Medical Record, where healthcare experts give insights into the increasing importance of following a patient's medical record through the health ecosystem with compliance, privacy, security, and efficiency front and center. This podcast is brought to you by MRO and hosted by Don Hardwick, Senior Vice President of Client Relations at MRO. Don has been in the health information management industry for over 40 years and has extensive knowledge of how medical records make their way through the healthcare ecosystem. At MRO, Don is responsible for strategic client engagement programs and overall client satisfaction. To hear from all of MRO's industry experts, be sure to visit mrocorp.com for additional content and to sign up for our monthly e-newsletter. Over to you, Don.
Hi, everyone, and welcome to another session of Follow the Medical Record. I'm your host, Don Hardwick, and thanks for listening today. I appreciate that. As always, you can learn more about MRO and myself on our website at mrocorp.com. And please take a moment to connect with me on LinkedIn. I'd love to hear from you. You can also follow us on Twitter at MROcorp. As my guest today, I have the Chief Innovation Officer with MRO. His name is Sanket Baralay. So, first of all, Sanket, thanks for joining the show. I really appreciate your time.
Thanks, Don. It's a pleasure to be here.
So, Sanket, before we get started into the topics, if you would, I'd like for you to explain to our listeners sort of your background. I know that you were a founder and CEO of a company called FigMD, and I'd like to know a little bit more about why you started that company, how that evolved into being a part now of MRO, and what your current role is as Chief Innovation Officer with MRO.
Sure, Don. So I started FigMD in 2010, and the impetus of starting FigMD was just a sort of a deep appreciation of the challenges that providers, doctors, had in measuring clinical quality and submitting their clinical quality measures for MIPS and other programs. Back in the day, doctors would have to actually manually report the quality metrics to CMS and others by filling out specific codes on their claim forms. And it was just a tremendous burden for them to do this. So FigMD came out of that need, and we basically came into a situation where we basically created a platform that did that for them automatically. So extracting data from EHRs, analyzing the records on the EHR to create the quality coding, and then helping the doctors out. So that's what was the genesis. That was the need that started FigMD, and the company scaled to cover quality measurement for 23 different specialties, and a significant portion of the U.S. Provider population. Transitioning into MRO, FigMD became a part of MRO just short of 2 years ago, and the thought process was to basically make that kind of combine the companies and supercharge the both companies. So at MRO, what my mandate is to kind of be the forward-looking force in the company, to understand emerging trends in healthcare, and to ensure that MRO is multiple steps ahead of market need, and we do we anticipate our customers' needs before even they know them. So that is my job day in and day out, and I'm thrilled to be a part of a phenomenal team. And growing the company over the last couple of years.
So what are some of those emerging trends that you referenced there that you see the intersection between what your company did in data gathering and so forth, and how that's fitting into the MRO vision?
Yeah, Don. So what's happening now and is that the burden for releasing information is escalating on the providers. There are more requesters out there requesting more charts and more clinical data and different types of data. So we're seeing a tremendous escalation in that burden, and what FigMD was really good at was to basically acquire clinical data at scale, direct from EHRs without providers having to be burdened by that process. So the idea here is that if there's an opportunity for us to reduce the effort around acquisition of charts, clinical data, reduce the burden, and then make it more efficient, make that chart or data more liquid, and make it more efficient for that to end up in a compliant manner to the requester. I think everybody wins. We're seeing that escalation happening in terms of just the volume, and we're working on some really neat technology and process solutions that deal with that challenge.
So, what are some of the bigger areas that impacts? I know that hospitals receive vast amounts of requests for data. What do you see as being the primary source of asking for that data? What types of requesters?
Yeah, so as you know, Don, the requester types are diversified, but I think if I were to kind of focus in on one, sort of really big bucket, it's the payers, right? So the payers, for multiple reasons, need charts, clinical data from our customers, and and that's escalating quite significantly as we shift our value-based care and a lot of other macro trends across the healthcare industry play out. So our focus, our sort of laser focus, is to create a platform, an environment, a process that allows us to accelerate beyond the velocity of these requests that are coming in, and to really do a good job in a super compliant manner to get the right data to the right requester at the right time. And do it in a way that just is super low burden on our on the providers, our customers.
So I'm glad you brought that up about the payers. Actually, I'd like to dig into that a little bit, because there's always been a little bit of a struggle between the providers and the payers. Can you elaborate a little bit on what some of those struggles were, why they're so difficult? And then what you see to improve that relationship, or that facilitating the movement of that data that will benefit both parties.
Yeah, so the way I look at it, Don, is when you come at this challenge from the payer's perspective, and you come at the exact same challenge from the provider's perspective, it's very clear to me that both parties are trying to do one thing, which is provision care efficiently for the patient, right? It's all about the patient. Everybody's working toward that common goal. Now, that being said, the immediate need for a provider is to give the best quality care to that patient that's in front of them, and make them better, and then transition that care. And as far as the payer is concerned, the focus is on reimbursement. The focus is on ensuring that the appropriate services are reimbursed appropriately, and so on and so forth, right? So I think the friction comes in not because of the intent that both parties obviously share, but because of the process and sort of the different aspects of that care provisioning and reimbursement that both parties are responsible for, right? So unfortunately, what has happened in healthcare over a really long period of time is, as technology has evolved, as systems have, improved elsewhere outside of healthcare, healthcare has been a little bit more deliberate, I would say, in adopting, some of those changes. So the burden on a provider is quite frankly, quite it's astronomical, if you will, to kind of furnish the data to the requester, the payer, in the right format, with a very, very low latency. And the payers, for all the right reasons, they need more and more data quicker, and to do their job, right? So I think that sort of sets up a little bit of a tug of war, sort of competing priorities on just the process, and not the focus on the patient specifically. But and from our perspective, from that, I think that's sort of the critical need for us to kind of help both parties communicate and facilitate information exchange in a compliant manner, at the right place at the right time, if you will. So that's that. I think that's really where we see the opportunity to kind of broker that communication between the payer and the provider, and have it be a super easy and frictionless process.
What are some of those friction items that's preventing that exchange from occurring in today's environment, with all the technology that we have, and both parties seemingly want to facilitate the exchange? Where is the barrier that you see for this being a complicated process?
Yeah, that's a great question, right? After all, one may ask that we as the healthcare industry and our government have invested tens of billions of dollars in promoting interoperability and the free flow of information, right? We've innovated around standards like FHIR and other sort of capabilities, right? So what is a friction, right? At the end of the day, after all that money spent, so the answer really lies in the sort of in the crux of this issue, where if you if you dig a little deeper here, what we're really good at, it's payers and providers talking to each other, electronically. We're really good at sending sending electronic messages, or like the way I describe it, like we can basically, it's like the postal service. You can send put any message in an envelope, send it over to anybody else, and it'll get there. That's really not the problem. Getting the message over, getting the record over, getting the file over is not really the challenge. The challenge of interoperability right now is that once you open that message, once you open the envelope, it's all different, right? So depending on the EHR, depending on other systems, how the interoperability works, the messaging, the structure, and the formats of the information is all over the place. And so it's very challenging for the requester to kind of, ingest the information or make sense of it, because it's all different, all different formats. And the same thing from a provider perspective. They're constrained by the sort of the usage of their EHR and how, generally, interoperability works. That's beyond their control, to kind of, to structure that information, right? So it's in the structuring of the information that makes it really, really difficult to consume, and that's the problem that again we've identified, and we have a lot of cycles that we're deploying against to solve. If we take a step back, okay, right? So the other challenge is that in a lot of instances, we're still struggling on the communication, right? So most of the ROI industry at the moment is on request chase lists coming in, and releases happening via digital delivery, but there's still scans and PDFs and so on, right? So that's a problem that's that's solvable. But to make it really, really super easy for everybody to understand the information, we have to basically get the information in the right format, in a common format that everybody can consume, and then it becomes much easier for payers to do their job, and it becomes super easy for providers to do what they're doing, because their burden reduces.
It brings up another thought here: is how common is the common platform to ingest that information? How common is that common platform?
Well, it's supposed to be common, right? So
It doesn't sound
when
like
we
it's
say
that.
no, it's not. No, see, look, that's where we have to really drive it to that commonality. It's like common sense, right? How common is that, right? So
Exactly. Yeah, that seems to be the hurdle here to me, is that there's not uniformity in the two systems, one on the provider side and on the payer side. They don't have a lot of commonality, it seems like. And is that pretty much where the barrier is between the two of them, working more openly together?
yeah, I mean, and that's a great observation, Don. The provider systems and the payer systems, were fundamentally created to manage different parts or different workflows or different parts of this process, right? But they all revolve around the patient. They all revolve around the clinical information that is generated, you know, in the treatment of that patient. So so really the challenge is the systems came from sort of different origin points, but they have to interoperate and they have to actually speak the same language. And that's really where the challenge is, and it's a challenge that is solvable. Look, at FigMD, that's exactly the challenge that we solved, right? We had the need to measure and benchmark data across 200 different EHRs and 23 specialties, right? So we had to basically normalize data. Let's say we had a cardiologist in New York and a cardiologist in Texas, and they're using Epic and Cerner and Allscripts, you name it, right? And the way they document their care for patients all varied because the EHRs were different, the individual physician documentation patterns were different. But at the end of the day, you needed to somehow benchmark their quality of care for the purposes of MIPS, right? And that's what we did. So we were able to basically bring all the data to a standardized format and make it consumable. And it'll probably take us another 2 hours to get into it, but we somehow made an apple into an orange, and then we had two oranges that were pretty much the same that we started eating. So we've done that, and that capability is rather unique within the company, and we're thrilled to kind of achieve that level of interoperability and usability, if you will, for our customers going forward.
It's certainly something that is a huge step forward between structured and unstructured data. Where in the past there was a request from those payers and it was produced, the documents that they needed were produced in a paper form virtually and delivered. Now it's the speed with which all of that can occur from a technology standpoint that does benefit both parties. I mean, the bottom line on the payer side on the provider side at that point, care has been rendered, and so the patient has then benefited from that treatment. Now it becomes a burden to get paid for that treatment. And sometimes, a patient stays in the hospital a long time, the bill is pretty substantial. And for the hospital to get paid, they need to facilitate the exchange of that information pretty quickly. So what you've done to address 200 different EMRs and moving that data into a format and a method that can be ingested by the payers is where the future's going. So certainly a big challenge here. What in terms of the innovation between the payers and providers, are there any other challenges, I guess, besides that uniformity of providing the information and the format, the commonality, the common platform? Are there other challenges that are involved in there that you see?
Yeah, it's certainly so. As we all know, the payer-provider relationship has been challenging, right? And I think unfortunately it suffers from a little bit of a trust deficit. It's just that's the nature of things. So I think curing that, in some sort of a systems-driven, process-driven, and transparent manner, is also the big challenge, right? So because ultimately everybody's working for the benefit of the patient, right? The payer is the providers, the pharmacist is whatever. Like everybody in this care continuum is working with that single goal in mind, is to serve the patient. So because we're doing it at sort of different we're addressing different life cycles, or segments of life cycles, if you will. Unfortunately, sort of this trust deficit has crept in. So I think if we solve the challenge, the technical challenge, and then the process challenge of actually making interoperability work, getting the right data to the right individual, the right requester at the right time, in an open and transparent manner, so everybody can, that's involved in the process has a really good understanding of what is going on and when and whatnot. I think that would result in a making significant inroads toward the trust deficit, and ultimately, I think if everybody's feels like they're playing on the same team, I think we'll just win the game, and in the interest of the patient, every single time. So again, we're really looking forward to that being a reality. Look, the way my mind works, Don, is I always look for, I ask myself, sort of this question. It's like, okay, let's assume that I'm waking up at 7 a.m. in the morning, and it's May 18th, 2030. Like, what does the world look like, right? And to me, like if I play that thought experiment, the world basically looks like, if I'm, God forbid, I have to end up in a hospital. If I'm in a hospital, I'm rendered effective, efficient, timely care, and I should be able to walk out of the hospital, as though I were a private pay patient, right? Meaning that by the time I'm walking out, everything's done, right? Like everybody's paid, everybody's happy, all the accounts are settled, I'm out. But I'm not a private pay patient. I'm an insurance patient. You know what I mean? So I think us solving these specific challenges in these specific processes will help us strive everybody to that future where insurance is not a burden. The cost of care isn't significantly burdened because of the processes that are involved in third party payment and so on and so forth. So and I think I'm really, really excited to be a part of a great organization, great team that's kind of I know is going to make a significant impact toward realizing that vision for the industry.
Looking at 2030, what one piece of advice would you give to providers to build towards that vision of how healthcare is delivered and the payments are delivered and provided to the payers, and then the converse of that? What advice would you give on the payer side to facilitate that 2030 vision?
I think, Don, if everybody, the payer, provider, us, if we're come to the table and just give everybody else the benefit of the doubt, and just understand that to realize this future in the interest of the patient, it will take a lot of change, and it will take a lot of change in a relatively short period of time. 2030 sounds that far, really far away, but how time goes, right? So I think we just need to be more open to change, just give each other the benefit of the doubt, and just really understand that everybody's working in the interest of the patient, and just trying to make everybody's lives better, right? Like at the end of the day, I'm looking at myself as a patient, my family, like we all are part of this, not just from a vendor or provider, from a payer side. We're all human beings, right? At some point, we're going to need healthcare, and I think it's our obligation to ensure the best system out there for the future, not just for us, but for our future generations. So I think just being that focused on how personal this is, I think it gets everybody rowing in the same direction.
Sanket, I really do appreciate you taking the time to meet with us and talk through some of these issues. It sounds like that you're doing some pretty innovative things and bridging a gap that's long stood between payers and providers. And it sounds like to me that you're making some, very nice inroads to solving some of those issues. So thank you for being on the show today. I really do appreciate your time and effort in participating.
Don, it's been a pleasure. Thank you so much for having me, and I look forward to having more conversations with you in the future.
Very good. So for more insights on a patient's medical record, visit the show's page at MROCORP.com and be sure to explore additional resources and thought leadership that we have on the website. Please check out our program also on healthcarenowradio.com. And finally, be sure to connect with us on Twitter at MROCORP. Until we talk again, I'm your host, Don Hartman.